Now, Joy News checks at the Obengfo Advanced Body Sculpt Center indicates the health center is open with some staff at work and may be operating illegally months after the healthcare facilities regulatory agencies, HeFRA, shut it down for its failure to meet the required standards for operation. HeFRA, as part of its regulatory enforcement measures, closed down a number of health facilities to ensure quality standards and compliance with health regulations for public safety. My colleague Kweku Asante is there and has joined us with more. Kweku, right. Let's rather speak with the registrar for the Healthcare Facilities Regulatory Agency, HeFRA, Dr. Philip Bano. Dr. Bano, are you aware that the hospital is operating?
Thank you for the invitation this afternoon. No, we are not aware it is operating. We've been monitoring the activities around that facility, and I've been there with the CID, and we've been there, our officers have been around. What we encountered was that the facility, curious enough, is also a residential facility. So some people live there. So we were posed with a bit of a challenge there. The case remained an active case. We've been at least a couple appearances before a judge. And I know that the last time was this past Friday, last week Friday, and the attorney for Dr. Obengfo tried very, very hard to get the judge to lift the order to lock the place. But I can assure you that the judge did not agree with his position. So we left the lock order still in place.
Okay, Dr. Bano, if I could crave your indulgence for just a moment. Our reporter who is currently at the site or has been there this morning has joined us. We just want to get some clarification. Kweku, what did you observe? Is it the case that the hospital is operating as a hospital, or there are just a few people walking around like they live at the premises?
Right. So when I got to the scene, you could see a number of cars parked at the premises, and then the HeFRA notice that is in front of the hospital saying that this facility has been closed down. It was expected that this facility should not even be in operation, or there should be no one there. And then I knocked, there was no one responding, and then I tried to enter. So when I tried to enter and I tried to go up where the walls are, a lady came out from out and then just met me downstairs and tried to explain to me that doctor is not around. That is what the person told me, doctor is not around. So I should call a certain number that she gave me so that I can make arrangements and meet doctor. According to her, doctor is not available this week, but will be available next week. And so if I call the person, we can make some arrangements and then we can meet doctor for the specific operation that we want to do. And so I called the number, and then I spoke to this person and we said that we should make a payment of 100 cedis. And that if we make the payment of 100 cedis, then we could take the process forward. And so for now, the person even has to expect them on WhatsApp and all those things so that we can take the conversation from there. And so that was my observation at the health facility.
Quickly, just a moment. Dr. Bano, thanks for staying with us. So clearly, that facility, whether or not it's in use, is still receiving persons who are making payments to officials of the Obengfo Hospital, and appointments are being made. What's HeFRA doing about this?
Okay, thank you again for bringing this to our attention. This is the first time we are hearing that people are making appointments or making payments. And as he said the doctor was not in. So if we get the evidence that he's actually there, seeing patients there, then as I said, we met because of the knowledge that people live there and if we open some of the back doors. We informed the CID and we were instructed to amend our complaints, and therefore the charges against him were also amended. So if you have further evidence that in spite of that warning, in spite of the judge refusing to lift the order to open, and in spite of the police order, in spite of the agency order, it is still recalcitrant. I won't discuss the next step, but I think it's obvious what we need to do again.
What would that be, Dr. Bano?
Oh, I don't think it is fair to discuss that on air. But the whole thing is that you have to do things per standard. So we need to have that evidence. and we've already dispatched people when it was brought my attention this morning that they actually could be actively. But as your own reporter said, the doctor himself was not there to see patients.
But Dr. Bano, you just mentioned that it's the first time you're hearing this on this program. So I'm surprised you're talking about this morning. Is this not a failure on the part of your organization? That there are healthcare personnel there who are receiving patients, and ultimately people are being endangered by coming into contact with these healthcare professionals?
No, if you heard me right, we have been monitoring the facility. We've been monitoring them with the CID. So
but they are still operating, doctor.
No,
they're still operating.
No, he didn't say they were operating. He said the doctor wasn't there. The doctor wasn't there. So if we're meeting with finance,
appointments were made. Is that not
the appointment is not clinical
operation?
And I'm not saying that this is all that we can do. We can spend we've been to court and twice, and his attorney, remember that he has legal rights. His attorney was there trying to lift it in the order for him to operate. The judge denied that. So if he is indeed doing what you are saying, and we want that as evidence first, if he's doing what you are saying, this is an allegation. We need to record that. So we need to have someone there going there to make a payment, seeing him. Then you have evidence. Then you can say that he has violated both the order of the police and the court and the agency. So then you have, but even the knowledge that people live on the premises and they even remove some of the background. The CID assisted us to amend the charges, our complaint, and therefore the charges are instant. So since the first arrest, there's an additional escalation. So I don't think we can say there's a failure here. We have a difficult situation, but
Dr.
not
Philip Dr. Philip Bano, thank you very much for joining us. He's registrar for the Healthcare Facilities Regulatory Agency.